If it's been years since you've seen your doctor, well, I'm going to need you to get in to see us, okay? If you're on medications for cholesterol or blood pressure, for example, I want to see you every 6 months. That's right. I want to see you every 6 months. But let's go to, say, the person who doesn't have any underlying medical conditions. I want to see you at least every year for a physical. And by the way, guys, I'm talking about adults only, not kids in this video. Some people say, some doctors, etc., say that if you're under the age of 50 and you're healthy, you can see your doctor for a physical every 2 to 3 years. Not in my office. Well, I mean, it's not that it doesn't happen, but it's not what I prefer. I want to see you every year. You know why? It's because even if you're healthy, there's still stuff for us to talk about. Preventative stuff. Your diet, your nutrition, are you exercising, your mental health, sexual health, all sorts of stuff. We might need to screen you for diabetes or blood pressure or things like that. Oh, there's plenty of stuff to talk about. So even if you're healthy, you're 18 and above, I want to see you at least every year. Now, let's go on to those of you who might be diabetics, okay? What do I say for that? Well, there's a range of things, okay? For most of my diabetics, I like to see them every 3 to 4 months. But if you're particularly controlled, like your diabetes is really controlled, I might push you out to 6 months. But it depends on how things are going. But just understand that if you have a condition like diabetes, you're probably going to need to and should be seeing your doctor more frequently than if you didn't have diabetes, okay? And I would also say, let's say you have a condition where we are making adjustments or trying to make improvements or making changes. Let's say your blood pressure has been uncontrolled and we've got to tweak your meds. I'm probably going to want to see you every 2 to 3 weeks until we get that settled, okay? So understand a lot of how often you need to see your doctor depends on, well, what's going on with your health, who you are, and how controlled your medical conditions are. And if you see your doctor for every 3 to 6 or 9 months or whatever for your chronic medical conditions, make sure you're still seeing them for that yearly physical, your well visit. Those are different visits and they're both important. But suffice it to say, if it's been years since you've seen your doctor, well, I'm going to need you to get in to see us, okay? That's super important. Now, the other thing I would say too is it often depends on are you seeing other specialists? What are they doing? Oh, and there's plenty of other medical conditions, by the way, that warrant multiple visits in a year, not just diabetes, right? Maybe you have some heart conditions. Maybe you have something else going on where we just got to see you multiple times. And remember, these are for routine, sort of what we call chronic conditions. If you're sick, if you got a lump or a bump, if something's happening that's funny around there, I need to see you when that happens, okay? Of course I need to see you for sick visits. The idea is not to bring you in every week. That's not it, okay? It's not about that. It's about making sure that with preventative visits, we're getting ahead of stuff and we are helping prevent disease, that we screen for things that we can prevent, that we counsel you, that we talk about education, we talk about things to help you live the healthiest life possible. And when it comes to chronic conditions you already have, well, we want to help those be as optimized as possible as well. So if you're not sure when you're supposed to see us next, make sure you ask us. But let me be very clear, the onus is on us to communicate to you when we want to see you back. Sometimes we don't do a great job of doing that. So in the case that we don't, or we're not clear, make sure you ask us. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me know, how often do you see your doctor? I'm curious. If you're my patient, how often do you see me? You don't have to write in the comments, but feel free if you want to. For those of you who send stars, thank you so much. I respond to you personally. Please like and follow my page if you have not already. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.